Good morning, everyone. This is Dana Corson from the Office of News and Public Information at the National Academies. Thanks for tuning into our webcast this morning. Quick housekeeping note, you can submit questions directly below where you are viewing the video on the webpage. There's a box where you can type in your question and submit it. So with that, I will turn it right over to Ann Yakteen. She's the director of the Food and Nutrition Board of the Institute of Medicine. Ann?
Thank you, Dana. On behalf of the Institute of Medicine and the Committee to Review WIC Food Packages, I welcome you to the briefing and release of the report, Review of WIC Food Packages, and Evaluation of White Potatoes and the Cash Value Voucher, a letter report. The Special Supplemental Nutrition Program for Women, Infants, and Children, also known as WIC, was established by Congress in 1972. This program is designed to provide specific nutrients determined by nutritional research to be lacking in the diets of the WIC target population. A review of the WIC food packages last occurred in 2005. Based on recommendations from the 2006 report on WIC food packages, the U.S. Department of Agriculture implemented a cash value voucher, or CVV, in 2009 to allow participants to purchase fruits and vegetables, not including white potatoes. The USDA has now asked the IOM to again review the WIC food packages. The complete food package review will occur in two phases. The first phase includes a separate evaluation of the 2009 regulation to exclude white potatoes from the WIC CVV. This letter report evaluating white potatoes in the CVV is the first of three reports for this study. In this report, the committee was specifically asked to: Number one, assess the impact of the 2009 regulation to allow the purchase of vegetables and fruits, excluding white potatoes, with a cash value voucher on food and nutrient intakes of the WIC population. And two, consider whether white potatoes should be permitted for purchase with the voucher. Joining us by phone to describe the report's findings and recommendations and answer questions, we have the chair of the committee and several committee members. These include Dr. Kathleen Rasmussen. The committee chair is professor in the Division of Nutritional Sciences at Cornell University. Other committee members who are with us today are Dr. Marianne Bittler, professor of economics at the University of California, Irvine; Dr. Alicia Carey-Query, professor of statistics, Iowa State University; Dr. David Davis, professor of economics, South Dakota State University; Dr. Tamara Hatfield, assistant professor of obstetrics and gynecology, Division of Maternal and Fetal Medicine, University of California, Irvine; Dr. Rachel Johnson, Robert L. Bickford, Jr., Green and Gold Professor of Nutrition and Professor of Medicine, University of Vermont; Dr. Angela Odoms-Young, Assistant Professor of Kinesiology and Nutrition, University of Illinois at Chicago; and Dr. Shannon Whaley, Director of Research and Evaluation, Public Health Foundation Enterprises, WIC program. The work of the committee was supported by a staff team that included Study Director Marie LaTulip, Research Associate Bernice Chu, Program Assistant Umbar Saeed, and Food and Nutrition Board Director Ann Yakteen. I'm pleased now to turn this briefing over to Dr. Rasmussen. She will present an overview of the report findings and recommendations. After that, she will open the briefing to questions. Thank you.
Good morning, everyone. It's my pleasure to share the committee's work with you this morning. Next slide, please. The committee was given a large task that you heard Dr. Yakteen describe in general, and this task consisted of conducting a review of the scientific literature to assess the current WIC food packages for consistency with the dietary guidelines for Americans, a review of the nutritional requirements of the WIC population, and conducting analyses of the dietary and energy intakes of this population. We were asked to conduct analyses of food expenditures of the WIC population, to review and assess the effect of cultural food preferences on nutritional needs and food intake patterns, and last, to develop plans for cost analysis on WIC food package components, food group and subgroup costs, and information on program participation. This list of tasks was designed to both prepare us for the work that I'm going to share with you today, as well as to set us up for the remaining phases of the work that Dr. Yakteen described. May I have the next slide, please? Our specific task also included evaluating the 2009 regulation that excluded white potatoes from purchase with the cash value voucher. We did this by assessing the nutrient and energy intake from white potatoes among WIC participants and WIC-eligible non-participants, by assessing the nutrient intakes referenced by the dietary reference intakes and estimates of adequacy, by calculating the food intakes for each food group and subgroup represented in the 2010 dietary guidelines, by calculating dietary quality indices to assess healthy eating scores before and after exclusion of white potatoes from the WIC food package, and last, by conducting a sensitivity analysis to assess nutrient and food group intake values relative to the dietary guidelines, and to project changes in indicators of diet quality when fresh white potatoes are included in the WIC cash value benefit. Next slide, please. By way of background, this story for our purposes begins at the time of the 2006 IOM report titled WIC Food Packages, Time for a Change. At that time, white potatoes were the most widely consumed vegetable, and Americans on average met or exceeded the dietary guideline, the 2005 dietary guidelines for starchy vegetables. And the intent of this novel cash value voucher, which was introduced for the first time after this, was to enhance diversity and intake of fruits and vegetables. Next slide, please. Well, it's almost 10 years later, and at the time of our current task, white potatoes remain the most widely consumed vegetable in the U.S., and their consumption has not changed appreciably over this period. Meanwhile, a new set of dietary guidelines has been issued, the 2010 version, and in this case, in this situation, the vegetable groups were revised, including a recommendation to increase the consumption of starchy vegetables from 3 cups to 5 for women and from 2.5 cups to 3 for children, and that's each week. As a result, Americans on average neither meet nor exceed these recommendations, and WIC participants consume about 64% of the amount recommended if they're women, and about 56% of the amount of starchy vegetables recommended if they're children. Next slide. The committee has been very busy since our first meeting in September. We have done a number of activities that were part of this process. We held a public data gathering workshop. We were briefed by the sponsors and had a public comment session. We conducted a comprehensive literature review that considered both peer-reviewed and non-peer-reviewed evidence, as well as relevant scientific and government reports, relevant reports from the Institute of Medicine, and of course we did quite a bit of data analysis. Next slide. Now I'd like to give you an overview of the data analysis that we conducted in the next slide. The populations we considered were women and children. The women were 19 to 50 years old. The 3 populations we considered were all these are among women and children at less than 185% of the poverty line or poverty income ratio. They were WIC or WIC-eligible non-participants, but to be WIC-eligible non-participants, they had to be pregnant lactating or postpartum. And we also considered WIC ineligible individuals who were in the same income group. They were women, but they were not pregnant, lactating, or postpartum. We also considered two groups of children aged 1 to just under 5 years. These were either WIC participants or WIC eligible non-participants. This means that we have considered basically the entire low-income population, but divided up into these 5 groups. The behaviors that we looked at among these 5 populations were their nutrient intake, which we compared to the dietary reference intakes, their intake of food groups, which were compared to the dietary guidelines for Americans, their dietary quality, which we assessed using the Healthy Eating Index 2010, and their intake of white potatoes in 2 forms, either those that might be WIC eligible, which is generally your fresh white potatoes, versus compared to types that would be ineligible. Next slide, please. The data source for these analyses was the National Health and Nutrition Examination Survey, or NHANES. We used 2 two-year rounds, 2007-8, combined with 2009-10. In these combined 4 years of data, we found few WIC women, so we combined all the subgroups, the pregnant, the lactating, and the postpartum women. We had hoped to be able to use the 2011-12 NHANES data for our analysis, but these are not completely released yet. The module that contains the WIC indicator is not released, and the software we need to establish, to extract food group information was also not available in time for this report. As a result, we were not able to conduct the analyses that were requested that compared food intake before and after the implementation of the cash value voucher. This will have to await the availability of data. Next slide, please. Now I'd like to move on with the findings, and I'm going to consider them in the same order: the nutrient intake, the food intake, the dietary quality, and the white potatoes. So first, we're going to be talking about the intake of nutrients. And while we did analyses on all nutrients, we focused our attention to the nutrients of concern that were identified in the 2010 dietary guidelines. And in this slide, you see the 5 of those 7 nutrients of concern that have an estimated average intake and permit us to calculate the percent of inadequate intake. And this is for women and children from NHANES over a 4-year period. The nutrients we considered were calcium, iron, vitamin C, folate, and vitamin D. We considered the 3 populations of women: WIC, WIC-eligible non-participants, and low-income non-participants, and the 2 groups of children in WIC and WIC-eligible non-participants. Let's just focus on the 3 columns of women for a moment. And what you see for calcium is that WIC women are doing better than the other 2 groups. But for all of the rest of the nutrients, WIC women are typical of other low-income women. They are doing the worst relative to EAR values for vitamin D intake, but dietary vitamin D is not the only source of vitamin D. For children, the children in the far right 2 columns are generally doing quite a bit better than the women. Fewer of them have an inadequate diet. And the WIC children are generally doing better than the non-WIC children. And like the women, the proportion who are not consuming enough dietary vitamin D is quite high. Next, please. We also considered, as the last 2 nutrients of concern, potassium and fiber. And they only have an adequate intake, not an estimated average requirement, so they were considered separately. And what I can tell you is for both women and children, their intakes were below the adequate intake. And for both women and children, WIC participants were similar to their respective comparison groups. Next slide. Now I'd like to move on to the food groups. So from nutrients to food groups. And here we're calculating the percent of the recommendation in the 2010 dietary guidelines met by, in this case, just WIC women and WIC children. Importantly, you will see that there are 643 WIC children in our analysis, which is a robust number of children for conducting such an analysis. But we only had 96 WIC women, which is not a robust number of women for conducting this analysis. To make this data easy to understand, I have used the traffic light system. Green is good here and red is bad. And as you look at the children, you see that they are at 90% or above of the recommended intakes for fruits, grains, dairy, and protein foods. And for women, it's just grains and protein foods. And they are below 50% of the recommended amount, or at or below 50% of the recommended amount. For children, it's dark green, red, orange, other, and total vegetables, but not starchy vegetables. And for women, it is dark green and red-orange vegetables, as well as total vegetables, and also fruits. So while women and children are doing somewhat better for starchy vegetables than other vegetables, there's still substantial room for improvement in starchy vegetables, as well as the other food groups that I've highlighted in red. Next, please. The committee was also asked to compare these dietary intakes using the Healthy Eating Index 2010 and another index of dietary quality. The committee decided that it needed to develop its own index to do that, and there was not time to do that in time for this report, but it will appear later. We're back to the 5 groups that we wish to compare, the children and the women, and we're comparing them here we're calculating the HEI score. This is a scale from 0 to 100. And the national mean is about 58. The 2 groups of children have values between 50 and 53, and the women have values between 45 and 47. So these low-income individuals are all doing less well than the national mean, but the differences between them are not large, and the variability is quite wide. So again, there's room for improvement among all low-income groups relative to the population as a whole, and of course relative to the range of the HEI score. Next, please. Now I'd like to look more deeply at starchy vegetable consumption, and here I'm going to focus on children in this and the next example, because we have more robust data. So these are children from 1 to just under 5 years of age. And what we're looking at is intake in cup equivalents per day. This is total starchy vegetables consumed at home on the left and away from home on the right. The gray part of the bar is starchy vegetables that are not potatoes. The blue part is starchy vegetables that are potatoes but are not potentially WIC eligible. And the green part of the bar is potatoes that are potentially WIC eligible if they could be included in the, permitted with the cash value voucher. So what you see here is that most starchy vegetables are consumed at home, that WIC eligible starchy vegetables, potentially WIC eligible starchy vegetables constitute about 40% of the starchy vegetables consumed at home. Next, please. What you see is that amount of starchy vegetables is 0.09 cup equivalents per day. So if you want to know the amount per week, you have to multiply by 7. This is an important number because this is the amount that could be influenced by the cash value voucher. It could increase if people chose to buy potatoes and feed them to their children with the buy potatoes with the cash value voucher and feed them to their children. So this is an important number, and we'll see it again in the next slide. Next slide, please. So The other thing that the committee did, another important thing we did, was to conduct a sensitivity analysis. And I'm going to describe the results of that analysis for you for children, based on this last slide, with a moderate increase of white potato intake. And what we modeled as a moderate increase of white potato intake was that 0.09 cup equivalents per day. We considered a moderate increase to be doubling that amount. We also considered the possibility that there would be no increase in intake of white potatoes, as it's possible for some of the subgroups of the WIC population that they either don't consume white potatoes at all and don't wish to, or their white potato preference is satisfied by the white potatoes they're already consuming. We considered the possibility that it would double the white potato intake that are WIC eligible and double the total potato intake. That was our extreme value. But here I'm focusing on the moderate increase in white potatoes. We also considered the possible trade-offs within the cash value voucher, assuming that the cash value voucher is fully redeemed, because our constraint was that this should be cost neutral. We considered trading white potatoes off against other vegetables but not fruits, and trading white potatoes off against the whole group of fruits and vegetables that a WIC participant could buy. And because of that, those two choices, we give you a range in the findings. So what we found was that the intake of vegetables in the other three subgroups of vegetables, if traded off just against vegetables, of course the other three subgroups would go down. But the total vegetable intake would increase overall because they were consuming more potatoes. And this could happen because potatoes are considerably cheaper than other vegetables. That energy intake would increase up to 0.7% per day because they're starchy vegetables and they have more calories per unit of measure than other vegetables do. Potassium intake would increase about 2% per day. And that the other nutrients of concern would change between not at all and about 3% per day, increasing in most cases. So what you can see is that there are some trade-offs here in terms of what people would consume. Next slide, please. Our other findings were that there was no direct evidence that consumption of white potatoes adversely affects the health of WIC participants, that the retailer and industry response to previous food package changes has been successful. When WIC called for a 1-pound loaf of 100% whole wheat bread, suddenly it was available in the market. And finally, that allowing white potatoes still permits the purchase of a wide variety of fruits and vegetables to account for cultural food preferences. People don't have to buy potatoes if they're permitted. Now I'd like to move on to the next slide and our first recommendation, which is that WIC should allow white potatoes as a WIC-eligible vegetable in forms currently permitted for other vegetables in the cash value voucher, pending changes in starchy vegetable intake recommendations in the 2015 Dietary Guidelines for Americans. If there are relevant changes in the 2015 Dietary Guidelines for Americans, the committee has more work and should reevaluate this recommendation. The next three recommendations relate to data needs. May I have the next slide, please? The committee recommends that USDA and the Department of Health and Human Services collaborate to achieve expansion of data collection on dietary intakes for pregnant, breastfeeding, and postpartum women and in Haines. I think from what I've shown you, the rationale for this is fairly obvious. We were very limited in sample size. And Haines is no longer, at the moment, oversampling such women, so this is going to continue unless there are more women studied. Next, please. The committee recommends also that USDA undertake a separate comprehensive examination of available data to assess the effectiveness of the current cash value voucher in meeting participants' food pattern and dietary intake goals as recommended by the Dietary Guidelines for Americans, including the use of white potatoes in the context of cultural diversity among WIC participants. We didn't have data that would allow us to do this, so it's certainly a need. And our last recommendation, next please, is really 5 different things that we're asking that recommending that USDA allocate resources for. And these are first, studies of the participant satisfaction with the cash value voucher. Second, study of the strategies that participants use to decide how much of the cash value voucher to spend. Third, studies of the strategies participants use to decide how to apportion this benefit among the vegetables and fruits, between vegetables and fruits, and between the cash value voucher and other food purchases. Fourth, we wish them to study how vendors have changed the WIC-eligible vegetables and fruits they stock because of the implementation of cash value voucher. And fifth and last, we recommend that they study how the cash value voucher and its implementation have affected vendors. All of these were things that we could not do well or completely with the data that we had at hand. And we think that the WIC program itself may have data that could be brought to bear to assist in answering these questions. Last slide, please. I would like to thank wholeheartedly all of the members of the committee to review WIC food packages. They include our co-chair, Gail Harrison from the University of California at Los Angeles, Susan Baker from the University of Buffalo, Marion Bittler from the University of California at Irvine, Patsy Brannon from Cornell University, Alicia Karakuri from Iowa State University, David Davis from South Dakota State University, Mary Kay Fox from Mathematical Policy Research Institute, Tamara Hatfield from the University of California at Irvine, Helen Jensen from Iowa State University, Rachel Johnson from the University of Vermont, Angela Odoms-Young from the University of Illinois Chicago, Catherine Ross from Pennsylvania State University, Charlene Russell Tucker from the Connecticut Department of Education, and Shannon Whaley from the Public Health Foundation Enterprises WIC program. We have been ably assisted by Marie Latulippe, our study director, and Anne Yaktine, the director of the Food and Nutrition Board, and we thank them all for their assistance as well as their staff. As Dr. Yaktine noted, many of these committee members are on the phone with us and will assist me in answering your questions. And with that, I thank you for your attention, and I'm assuming on my screen I'm going to see some questions.
This is Dana Corson. I see the questions coming through, and I will announce them to everybody.
Okay.
So just a reminder, where you can submit a question, it's right below where the box where you're viewing the slides online. And if you can please include your name and affiliation when you submit the question, that would be great. So to get us started, our first question comes from Joan Zerzan from Washington Department of Health. Her question is there evidence to support that the changes in WIC potatoes would in fact alter intake of other vegetables?
We can model that statistically, but we don't know enough about how WIC participants decide to make their purchase to be able to say whether they would or would not behave that way, which is why we called for the collection of data that would inform us about that.
Okay. Next question. Can you talk about next steps given the limited data available to you?
Well, our next steps involve acquiring the 2012 data so that we have a more robust sample to work with, and to completing the first set of tasks that I showed you in the second slide. And then moving forward from there to be doing some modeling to answer the question of whether the food package should change. We have the data we have, and we have to work with it. I think I'll stop there.
Okay, next question. Um, how is evidence-based and/or problematic is nutrient density as a criterion for deciding what vegetables humans ought to be eating?
That's outside the scope of the report. If there is one of our committee members who would like to try and answer that, they're welcome to chime in. But I think this isn't a question we can answer for you at this point. I don't hear any volunteers, so I think we might go on to the next question.
Okay. For the next phase, will the 2011 to 2012 NHANES data be used?
That is our intention, yes, as soon as it's available.
Okay. And this is a follow-up question from Joan Zerzan from Washington Department of Health. Did you also consider nutrient comparisons? For instance, is there a true difference in nutrient quality between potatoes and lettuce?
I am going to, is Patsy Brennan on the phone? She's not on the phone. Well, one of the people who were involved in our data analysis was Dr. Carrie Query, and I believe she is not with us. Okay, so.
I am here.
I'm showing X on my phone. Please, please.
Yes, I am here.
Repeat the question, please, so that Dr. Carrie Query can have a chance to answer it. To ask about a true difference in intake.
I think the question was something to do with the quality of nutrients in lettuce and potatoes. For example, is 1 milligram of niacin the same in lettuce as it is in potatoes? And the answer is whatever the food composition tables tell us about nutrient content is what we have used. And so depending on whether there's a difference in the quality, if you will, of nutrients across different foods in the food composition tables, we didn't do anything about it.
Okay. Would the person who's reading the question read the question again, please?
Sure, sorry about that. Did you also consider nutrient comparisons? For instance, is there a true difference in nutrient quality between potatoes and lettuce? And Dr. Whaley, do you have a suggested response for that?
I do not. I defer to our nutrition experts on this comment.
Right. So the Dietary Guidelines for Americans Committee, in their wisdom, created categories of vegetables, and something like lettuce is not in the same category as a starchy vegetable. And we expect these different categories of vegetables to deliver different patterns of nutrients. And the Dietary Guidelines Committee is valuing all the different categories of vegetables, but they do different things. And so we were working here with just white potatoes. We have the next question, please.
Sure. This question comes from Tatiana Andreeva, an associate professor from the University of Connecticut. We know that most of cash value voucher spending is currently on fresh fruits. If white potatoes were added as eligible for cash value vouchers, how would you expect them to affect fruit cash value voucher purchases? Based on the data you presented, it sounds like you'd only expect a decrease in vegetables.
We thank Dr. Andreeva for the question. We modeled two scenarios. One scenario was white potatoes traded off against other vegetables, and the other scenario was white potatoes traded off against vegetables and fruits. and we modeled them as an equal effect on each of the subgroups of vegetables, because we have no way of determining the relative preference for them. I believe Dr. Suzanne Murphy is on this call. And
she's not on the call.
Not on the call, okay. All right, I was misinformed. But in answer to this question, we did consider both of them, but we considered them as possibilities and modeled them directly. We did not have information about actual preferences to guide the likelihood of what people would do.
Mm-hmm.
Next question.
Can you please, this question comes from Amy Laster from the Intertribal Council of Nevada WIC. Can you please state again how you defined a moderate increase in white potato intake?
Yes. In fact, we could even go back to slide 14, if that's possible, Amber, please. Right there, that's the one. So we defined a moderate intake as doubling the amount shown in the red bracket, 0.0 cup equivalents per day, doubling the amount that these children, in this case, would be of WIC, potentially WIC eligible vegetables that they would be, WIC eligible potatoes they would be consuming. So these are in the fresh form primarily.
All right, next question. Can you tell us what you learned from your healthy eating index analysis?
Okay, can we go to that slide, please, which I believe is number 12? Yes, there it is. What we learned was that there was room for improvement in the diets of low-income individuals in general, both for women and for children, in the WIC program and not in the WIC program. Would any other committee member like to comment further on that? Okay, next question, please.
How could the 2015 DGA affect your recommendations?
And who's the question from, please?
They didn't identify themselves.
Okay. The 2015 dietary guidelines could potentially change the vegetable categories. Again, they could change the amount in the starchy vegetable category again. That could cause us to reevaluate what we found here. Next question.
Can we remove sugary beverages and chips and other snack foods from WIC and other benefit transfer packages?
May I have Dr. Whaley respond to that, please?
Sure, I'd be happy to. Those are not foods that are currently allowed in the WIC food packages. It could be that there might be some confusion here with SNAP, the Supplemental Nutrition Assistance Program, that allows participants on that program to purchase a much wider variety of foods. So the current WIC food packages do not allow purchase of any of the items just mentioned.
Okay.
Next question is, how about prioritizing whole foods? Maybe a, quote, double credit for whole vegetables rather than prepared and processed or boxed foods?
So again, this is Shannon. those foods are not currently allowed on the WIC food packages. The cash value voucher, as it's currently formulated, allows for, in the federal rule, allows for fresh forms or frozen or canned forms as long as there's nothing added, no oils, no sugars, no fats, no salt, for example. So I don't believe that, I think we're in the same boat as we were in the last question. Those are not currently allowed in the WIC food package.
Next question.
So that is all the questions we have for today. Thanks everyone for tuning in. Another quick note, the slides will be posted within the next few days on the project page. So you can take a look back to access those slides. Thanks everyone, and have a good rest of the day.
Bye.